everywhere where there are large cities, there is presence of this variant. It was predicted, it's important to repeat it, that the variant is gradually going to become the dominant strain, is going to become the most important percentage of new cases, and that variant is more contagious. So it is normal that there is an increase in the number of cases. However, it is very important to look at the trend of cases in each of Quebec's regions, particularly the trend toward hospitalizations, because, of course, there is a change in the makeup of cases. On average, there are more younger people who, generally speaking, go less to the hospital. So it's normal that there's a greater increase in the number of cases, but it is not necessarily being reflected with the number of hospitalizations. And it takes about a week or two as well before we are able to see the results in the number of hospitalizations, and that is why it is important to have projections. And Thursday or Friday, as we do every week, we will be making these new projections public, those of the INSPQ. What is important when I say that we have to look at things regionally? It's almost surprising, but when we look at the Montreal area and the regions around, we see that there has not been, in the past few days, an increase of cases. In the past week or two, there's even been a very slight decrease in the number of cases. That means that the situation in Montreal is stable. The situation today, I mean, we don't know what will be happening over the next few days necessarily, but the situation as of today is no worse than what we had a week or two ago in Montreal. It remains stable. However, there has been a strong increase in 5 other regions. 5 regions that had recently gone to orange. The one that worries us the most is the Outaouais region, most particularly the city of Gatineau. We also know that there's an important link between Gatineau and Ottawa, so we are discussing right now with the Ontario government to try to standardize our measures between Ottawa and Gatineau. But the situation is worrisome. You know that it's been quite some time as well that the situation of health is difficult there. There's an important hospital missing in the Outaouais that was even before the pandemic. We're working at adding a hospital with 700 beds, but as long as the hospital is not there, it's going to remain more difficult in the Outaouais region. So we're not excluding over the next few days or weeks adding measures in the Ottawa region. It would be the situation, but because it is a situation that worries us the most. The other one that concerns us is here in the national capital, in Quebec City. There are no problems in the Charlevoix or Portneuf. It's really in and around Quebec City. Thankfully, in Quebec City, we do have a very large hospital capacity. So according to our projections over the next few weeks, if the situation remains as it is today, we should be able to accept this increase that we see in cases and hospitalizations in Quebec City. But the situation can change very quickly. So we are keeping a close eye over the National Capital Region. There are 3 other places that concern us. The Beauce region, and we see that there really is a very important difference between the Beauce region and Lévis or the rest of Chaudière-Appalaches. There really is a very strong increase in the Beauce region. Very strong increase as well in the Lac-Saint-Jean area. So I'm not talking about the Saguenay. I'm really talking about the Lac-Saint-Jean around Robertval. There's a very significant increase. And in the Bas-Saint-Laurent, Lower St. Lawrence, around Rivière-du-Loup and Kamouraska. So that means that these 5 regions, the Outaouais, the National Capital, the Chaudière-Appalaches, the Saguenay-Lac-Saint-Jean, and the Lower St. Lawrence are really under very high surveillance. So I would say from one day to the next, or even hourly, we look at all those regions and outbreaks hour by hour, and we can't exclude anything over the next few days. But it is important to say that we're talking here about trends. If we look at the number of active cases, there has been an increase in those 5 regions, but we're not yet at the level of Montreal. So, in total number of active cases, keeping all proportions in mind, there's fewer than in Montreal. Montreal is stable. However, if the trend were to continue over the next few days and weeks, we could end up in a situation that would be worse in those regions than in Montreal. It's also important to bring one clarification, and I'd like to remind you, because there are people who only look at the number of cases. What we look at most particularly is the number of hospitalizations and the predictions in the increase of hospitalizations over the next few weeks. So, the projections, we've had preliminary projections over the weekend. They're being finalized and will be handed to you Thursday or Friday, and you will be able to see that the situation remains within our hospital capacities with the present projections. However, the situation can change very quickly. So, over the next few days, the following days are going to be very critical. And the question that we're asking ourselves is, should we add restrictions in these 5 zones? For the time being, what we believe that is the most important, more important than adding measures, is to make sure that the measures that we have right now are better respected. And we're thinking, for example, about all visits taking place in homes. A reminder, when we took the curfew from the 8 p.m. to 9:30 p.m., it wasn't a message telling people you can now go into other people's homes until 9:30. No, it is still forbidden to go into other people's homes. In the upcoming weekend is Easter. It's a long holiday. There are people who have either Friday or Monday off, so a long weekend. We are concerned. We're wondering whether we shouldn't do anything specific for the Easter weekend. First, it's not a good idea to have family get-togethers or parties amongst friends. And I've also asked the Minister for Public Health, for Public Safety, Geneviève Guilbeault, to make sure with all the police forces that they'd be more present this coming weekend than they usually are. Of course, if the measures are respected, cinema, theaters, places of worship, sports, and others, if the measures are respected, we can continue with those activities. But I'd like to repeat it. What is most important are the visits in homes. So we can see that the problem is not what is allowed. It is what people are not respecting in the things that are still forbidden. It's always difficult to have data, but the INSPQ has made some surveys, and they have arrived at the conclusion that young adults, about half, do not respect guidelines in terms of homes. That means that there are young adults, half of young adults right now, go see their friends and do not respect the guidelines in people's homes. That is very serious, and we have to find a way. It's a question of solidarity. First, solidarity toward staff in our hospitals, and also solidarity toward younger children. Because I want to get back to something. Some people have had comments on the full-time opening of secondary 3, 4, and 5, so full-time in schools. We believe that, yes, there is a risk associated to the fact that children are in school full-time, but we believe that the risk is greater if we keep them at home. First, greater for their learning and their academic success, but also for their mental health. And right now, yes, there are classrooms that are closed, but there's 96% of children in Quebec that are in school full-time. 96%, that is my greatest pride, and it should be our greatest concern in all of society. I'm thinking about young people who are 20, who are 25, who organize, are having parties. Think of the ones who are younger. Think of the children. It's very important, and I need that everybody get involved. A word on vaccines. First, to tell you, the regions where things are more difficult, we are going to be increasing proportionally the vaccines that we will be sending to those regions. So we're going to give ourselves every opportunity of not being forced to go back on measures. And so there's a new organization of the distribution of vaccines in order to be able to give more, keeping everything proportionally. So sending more to those regions that are having more difficulties. A word on the AstraZeneca vaccine. First, it's important to say the following. In Quebec, we have had no problems with this vaccine. There is a very minimal risk for certain people below the age of 55 years of age. And we're not even sure, but it is as a precaution that public health is telling us we are going to suspend the handing out of the AstraZeneca vaccine to people 55 and under. Public health is telling us that it's completely safe for people 55 and over. So that is very important to say to the public. I would like to end by saying we are in a third wave. What we wish is for it to be as short and weak as possible. And for that, I'd like to come back to visits in people's homes and visits next weekend for Easter and Passover. I understand that people look forward to seeing one another, but I'd like to repeat it. Let's think about the nurses. Let's think about our children. This is not the time right now. It is critical what is going to be happening over the next few days. And I am very frank with you. Right now, we have scenarios to, unfortunately, increase restrictions in the 5 regions that are going through difficulties right now. It's important to say it as well that there are other regions, for example, if we think about the Eastern Townships, the Mauricie, Centre du Québec, that went to orange, and where there's been no significant increase in the number of cases. So it is possible to respect the guidelines despite the variant and despite this more contagious or this more present variant. So the summer is coming up, but we have some demanding weeks ahead of us. You saw good news earlier on. We're going to have more vaccines in the month of June. But despite that announcement, despite the restrictions that we are putting on the AstraZeneca vaccine, we're still confident that everybody in Quebec who wishes to be vaccinated will be able to have a first dose by the national holiday, which is, in June. So I'd like to end by asking you for your collaboration and your solidarity. There's a few weeks left. No visits in people's homes. And as soon as you can, with your age group, go get vaccinated. Be prudent, and be prudent.
Good afternoon, everyone.
English.
We've seen an increase in new cases in the past few days with the third wave, but it's important to say that it's not increasing in all regions. In Montreal, the situation is stable. We see a significant increase in 5 regions: Outaouais, Capitale-Nationale, Chaudière-Appalaches, Saguenay-Lac-Saint-Jean, and Bas-Saint-Laurent. These regions are not at the level of Montreal, but there's a bad tendency, bad trend. We should see an increase in hospitalizations in coming weeks. At the moment, we expect it won't exceed our capacity, but that can change very quickly. The next few days will be critical. The most important thing is to respect the rules in place. Gatherings in homes are still forbidden. I ask our Minister of Public Health to make sure our police officers are very present during Easter weekend. We're seeing that the problem are not the rules in place, but the people who don't follow them. I also want to say a few words about the vaccine. We'll send more doses to the regions where we have more difficulties. I also want to say that the AstraZeneca vaccine is safe for people over 55. The greater risk is to refuse to get vaccinated. Summer is coming, but we have a few more tough weeks ahead of us. The third wave is here. We must continue all our efforts until we're all vaccinated. I ask you not to gather in homes, and please get vaccinated as soon as you can. Thank you.
J'aurais deux points à faire aujourd'hui rapidement. Premièrement, sur nos objectifs.
2 quick points to mention today. First, on our objectives. I think it is important to emit a reminder that the objective we had given ourselves in December to get to 1.3 million vaccine as of the 31st of March, we reached that goal yesterday. So I am very proud of that. And the reason why I want to get back to that objective is that over the past 3 months, you've experienced it, we experienced it together, there's been ups and downs. Remember Pfizer that was delaying their deliveries because they had production problems, Moderna, same thing. And at each moment, we had moments of significant uncertainty. But we got used to working with that uncertainty, and Quebecers have supported us. And on the side of operations, we've always found solutions to be able to vaccinate according to the objectives that we had given ourselves. So I would like to say that as compared to our objective of the 24th of June, although we've had some bad news this week with AstraZeneca, in the days following, we learned from Pfizer that we're going to have additional doses in June and perhaps even before. So I would like to remind Quebecers that our objective of the 24th of June is still there, and we're going to do everything with our excellent vaccination team. I get comments every day. People who will get vaccinated, who are very satisfied. I thank them, and we're going to continue reaching our objectives. So that was my first point. And to get back on what the Premier said concerning the doses and regions, it is obvious that at the request of public health, we have made the decision in the past few hours to send vaccines, extra vaccines, to some regions. And I would say that the main reason is the increase of the variants in those regions, but also to make sure that we are able to level out as much as possible the gap that we had in the different age groups. For example, between Montreal and in other regions where the age category was higher. I'm thinking, for example, where it is important to bring these adjustments is in the Lawrence-St. Lawrence and in the Outaouais region. But a reminder that we had added doses a few weeks ago in Montreal because we were really the epicenter in Montreal, and it was normal to do that. So I think it is also normal today to do the same thing and to support those regions a bit more. And I think that we're going to have very targeted actions over the next few weeks, and I think that it is also going to allow to reestablish that balance between the number of cases and the number of variants. I would also like to give another reminder. People were perhaps doubted that we were not going to be able to reach. Remember when we had an objective of saying that we had to vaccinate 5 million people, or 5 million vaccines for the 24th of June, which made an average of about 50,000 vaccines in 100 days. Well, we've already gone over 50,000 per day many times. So I'd like to remind you, I know that we have a lot of collaboration from Quebecers, but we are respecting our objectives and will. And once again, when we get the vaccines, we deliver them. To conclude, and I really support the Premier and Dr. Arruda, while we are vaccinating, people have to keep respecting the rules. Vaccinating is all good, and you've seen it with the presentations that took place. Next week we're taking into account that we can uphold our healthcare system. But while we're vaccinating, people have to be able to respect the rules. We're all in this together, and we have to continue in this together. Thank you. Question period.
Justement sur AstraZeneca.
On the AstraZeneca vaccine, right now, I've received messages from practitioners and acupuncturists who say that they want to be called, they want to help out. Do we have enough staff right now? And with the vaccines that we're getting, is it enough? Or could we do more? I think that we could take even more people externally. We've had over 6,000 people who went through Je Contribue. What we're doing right now with these people is that we can train them, because what's important is also to be able to train them. And I would say that that we've made important announcements with companies in the past 10 days. We've given ourselves until the 5th of April to select those companies in Quebec that are going to add complementarily to our pharmacies and our mass vaccination centers. So now we're a week away from making the selection of those companies, and it is obvious that it is there in those companies that we will need people to vaccinate to help us out. So when the companies are chosen, we said that we take between 20 and 50. Well, I would invite people who wish to continue going on Je Contribue to do so, because we've had vets, we've had all sorts of people who have come to help us and who've made a big difference over the past few weeks. So I would invite people to continue going on that site, because the training that we need to give will be given in April, so that we're ready with the larger weeks of vaccination in May and June, once we're over 50,000 vaccinations per week. Concerning the Easter holidays, Mr. Legault, places of worship at 250, was that too quick of a jump? When we see some people from the Jewish community who came from New York last week to come to Montreal, and now it's a Christian holiday over the weekend, have we gone too quickly in places of worship? Well, I think that if the guidelines are respected, whether it be places of worship or cinemas or theater rooms and show venues, if people are 2 meters away, if they wear a mask, there's no problem. But it is an opportunity that people have, If they go out of the church and they get too close and they no longer respect the guidelines, that's a problem. But if we respect the guidelines, it's okay. But what worries us the most are gatherings, people grouping up in people's homes. I would like to know. The federal government just announced that we're going to receive millions of doses of vaccine, including AstraZeneca. What are you going to do if Quebecers refuse to receive that vaccine? Maybe I can start on the logistical aspect of it, and then Dr. Arruda can complete on the clinical part. What we're going to be doing over the next few days, we're going to get things organized so that places of vaccination and vaccination schedules be clearly indicated that they are from AstraZeneca vaccine. So to be sure that somebody who makes the decision, who's 55 and over, who has the choice between getting vaccinated in April or in May, and decides that they, for example, prefer having the vaccine from AstraZeneca right away, and that they respond to the requirements, well, it'll be clearly indicated that at this time, in this place, these will be AstraZeneca vaccines. What that will allow us, logistically speaking, is to say, and I think that I'm a very good example, to say that, after almost 2 weeks, I've had no symptoms, and I am in that clientele, and like my colleagues, like Marguerite Blais, people who are over 55 years of age who got vaccinated, and it allows us to get vaccinated more quickly. So we are going to do the work that is necessary logistically speaking. We're bringing adjustments on the Clic Santé website so that it's possible to choose the Covishield from AstraZeneca if you want to get vaccinated more quickly. My question is, what are you going to do if some Quebecers refuse? Well, it has to be understood that first we're going to inform people. We're not going to, we would not let people get vaccinated with something that isn't safe, first thing. But there's never been an obligation of vaccination, and you need to be a consenting adult. So I know that there are people right now who have refused it, who are going to come back to another appointment. That's what it means to have informed consent. But anyway, there's bad press around that vaccine. But now, before people even come, they're going to know if it's what it is. But for some people who want to get vaccinated before, because don't forget that the risk of going through a complication, of COVID, even of coagulation associated to COVID, is greater in those groups than the risk associated to the vaccine. What is clear for now is that we've decided to stop it for people 55 and under. It's a temporary suspension. We're waiting for the analysis of data. And I think that people will be able to be vaccinated with a vaccine that is going to be good for them without us forcing them to have one vaccine or the other. I would like to know, you were talking about visits in people's homes, and you said in the media, Mr. Arruda, that some people did things behind closed doors. What is the proportion of Quebecers that do not respect, for example, the measure that visiting in people's homes is forbidden right now? Well, as the Premier was saying, it's according to certain surveys, it's an increase of the number of people who, don't necessarily follow hand washing, wearing masks, distancing. We've noticed that there's a slackening in those measures. And right now, we have also noticed that in younger adults, and when we're talking about younger, we're not necessarily talking about people, we're not talking about teenagers. There's, people between 20 and 30 or 30 and 40 who say that they haven't necessarily respected the guidelines. So it's gone higher, even up to 60% in certain regions, particularly in those regions, I would say that they went to orange zone. There's a link, there's a direct link between those regions and the increase in data. And what is very pertinent is that regardless of the measures that we set up or, different measures, what is very well shown is that the most important factor is whether people follow the guidelines, because between what we say that should happen and what actually happens, that is what decides the consequences. So having strong measures allows, things to get better. But if people, when they go to the gym, they get together before, they get together after, they go to people's homes, they go to a restaurant without respecting. If the companies don't do the work of having them respected, well, we don't reach our objective. So the third wave is going to depend on our collective response, all of us.
Bonjour à vous trois. Mr.
Arruda, in your team and in the other public health regionally speaking, are there members, are there people who did not agree with the measures that were slackened and who are asking for things to be tightened up? The directors of public health are like any other members of society. They have different cycles of fear and others. There are people who have expressed that they had concerns. But directors of public health are also, show solidarity toward decisions. And this is an important element. Now we're focused on the COVID-19 disease, and we have concerns about this. But let's not forget the impacts on education, on academic success, on mental health, on certain suicides that could take place. And when we're in public health, we're not just people of infectious diseases. We are people who look at all the health determinants together. And I think it's important to keep that in mind. And what is happening right now was expected. Don't think that we had the impression that we were going to be able to control the variants, that they would remain at 10%. That happened nowhere in the world. So, we are not better protected here. We know and we knew, but what we're doing now is we're keeping an eye on things. And what's also important, I've said it, when we prescribe something to society, it's not because everything is open that you have to go everywhere. The more you increase your contacts, the more you have the opportunity of increasing the variant. So yes, there are different opinions that can be expressed, different concerns and fears, but we have to take that into consideration, because there's some people today who are saying that we should be more prudent. 3 or 4 weeks ago, we're saying that we had to be, different because people couldn't go on anymore with the measures. It's a very difficult balance, but be assured that we are keeping the data in mind from hour to the next, and we could very quickly change things if the situation becomes out of control. But that is between us and yourselves, the public, if you respect the guidelines. Mr. Premier, I quote you. You said that you already have scenarios in case of increases to add restrictions. What do these scenarios look like? Scenarios, yes, I'm not going to start going over every single scenario, but we're looking at different possibilities because, yes, it is worrisome what is happening in those 5 regions. Now, I said it. What concerns us most are people getting together in others' homes. How can we reduce people meeting in people's homes? Now we're studying different scenarios in relation to this. Well, that was my question. What are the means that you could take? We understand that there are coercive means, that is, for example, to give people fines. But what are the means that you could take to make sure that there are no visits in people's homes? I mean, it's difficult. Well, there's already one, which is to have more police presence. So the curfew, to have a better follow-up of the 9:30 p.m. curfew. And as I said earlier on, the region that worries us the most is the Outaouais region. Are we going to have roadblocks between Quebec and Ontario? Do we have to make sure, and of course that requires the collaboration of Ontario, but I know that in Ontario there are restaurants that are open with more lax rules than ours. I'll give you an example. If the Outaouais went back to red zone and we closed down the restaurants, but those from Ottawa were open, we have to take all of those things into account and think about them. My other question concerns vaccination. We heard this week and over the weekend the Collège des médecins who were saying that what concerned them was transmission in young people, particularly the decision to have allowed secondary 3, 4, and 5 students, even in red zones, to go back to school full-time. For them, it's like an alarm bell that it shouldn't be done, that they even asked you to go back on that. Knowing that young people don't follow the measures as closely and taking into account the fact that in certain regions you want to target certain vaccines more for regions that are at higher risk, might you favor vaccination in teachers and parents of students? Is that something that you're thinking about to try to limit the impact that transmission amongst young people could have? Well, I'll start, but it really is a question where Dr. Arruda could also talk about. We had a project in Montreal with Dr. Drouin, a pilot project where we did exactly that to see what impact it would have to vaccinate the parents and the teachers and professors. Unfortunately, it's a little too early to have results because we haven't been able to see the impact. I think we have to follow it very closely. But I think that globally speaking, it has to be understood that the reason why we did it, opening schools, it's because it's our priority. It's our priority to have children in school. I saw it in the field, people who were so happy to have the children go back to school full-time. So I would tell you that that was our first objective. Now, are there projects like we saw in Montreal that would give positive results? Could that encourage us to do what you're asking? I think I'll let Dr. Arruda talk about it. I find it important to say that the education of our young people has always been very high on the list of priority. Even the first wave, we had opened up certain schools in regions outside of Montreal. People were scared and all that. And we are very conscious of the fact that in schools there is transmission. We are managing those situations. We're also conscious of the fact that it's a place where there will be variant, yes, and that it will multiply. But when we look at the benefits of maintaining children in school as compared to all the others, well, we manage that risk. And in fact, depending on the availability of vaccines and the strategies of protecting those areas to decrease the transmission, that is one. But with the quantity of vaccines that we have right now, we have to go protect those people who are at risk of complications. And that is a strategy that we used with the elderly. But we're looking at that very seriously for schools as well as daycares. Would it be possible to have a timeline? It will depend on the number of doses that we have available over the next few weeks, and it will also depend on our ability to be able to reach other groups, priority groups, depending on the age or chronic diseases. I can't give you a timeline, but it'll be as quickly as possible. Mr. Legault, just before the press conference, Louis-Charles Letoin-Yamanet said that he was leaving the caucus. We found out that he was formally under investigation by the UPAC. First, I'd like to know whether you are the one who asked him to leave the caucus, and I would like to know whether you don't find that you have minimized the facts last week when you said, no, there's nothing illegal. Well, first, the facts are not the same. Last week, we were talking about dezoning. Now we're talking about many possible alleged infractions. Second, it was a mutual agreement. We talked, Louis-Charles and I, this morning, and we agreed that he would leave the caucus of the CAQ. That is what he had to do while waiting to have the results of the investigation. Yesterday, Mr. Arruda, you said you actually doubted the objective of the 24th of June, said that maybe it wasn't going to be reached, the objective that Mr. Legault had fixed. I'd like to know what, are we going to manage to succeeding in vaccinating everybody who wishes to be vaccinated by the 24th of June? I'd like you to know that I take part of the scientific area of the vaccination. My colleague Daniel Paris is the one who takes part of the logistical aspect. What he said, because I said that there might be a minor effect, what he told me is that the 300 cube doses of AstraZeneca that we had, that were announced, they were beyond what had been used to plan the 24th of June. So I'm sorry if I brought about a confusion. I said that if there was an impact, it would be marginal impact because it's only 300,000 doses. But as on top of that, they are beyond what had been agreed for the planning of the 24th of June, there will be no impact. And if ever other doses arrived in June, it'll depend on when they arrive. It's even possible that it'll be before. But you know that in vaccination and in inventory, these are things that change from one day to the next. So it becomes very difficult to project ourselves to June. But as we've done it up until now, we've reached our objective. In March, I think that we're all very well organized to reach the objective as of the 24th of June. You said here in this room that Quebec was resisting against a third wave. That wasn't very long ago. Dr. Arruda has just told us that he knew what was happening in Ontario and Europe, that you were conscious, that you had projections. Were you too jovial that made it that Quebecers put down their guard? No, what I said on Friday last is that up until now we were resisting. Perhaps it was even surprising because we saw that in many other places, including in Ontario, Massachusetts, and Illinois or Michigan, the third wave was already there. Up until Tuesday last, we were resisting. However, every weekend, I see the projections that are given on Thursday and Fridays. And in those projections, we could see two things. One, an increase in the number of cases and a weak increase in the number of hospitalizations, but within the capacity that we can accept. So that is what I was saying. Until last Tuesday, there wasn't a third wave. Last Friday, I said, well, we are at the beginning of a third wave, but it's important to say it again today. With the presence of the variant, it was normal, but we have to distinguish the number of cases from the number of hospitalizations and the projections. Well, I'm looking at them. and I've been looking at them for a long time, on Sunday afternoon with Dr. Arruda. Talking about the doses, we had the information that there would be 30,000 doses leaving Montreal to go to the Lower St. Lawrence. So you confirm that you are moving doses from Montreal? So there's going to be fewer doses accessible in Montreal to go more to those regions, other 5 regions? Well, the number of doses, I don't know exactly because we're still discussing this morning. What we've managed to do, thanks to the collaboration of the CEOs of the Greater Montreal area, for example, is to make sure that all the appointments that had been made this week would not be affected. These had not been confirmed, so it won't change anything for people who had already taken an appointment in the Greater Montreal region. The surplus, that is people where we followed every day, the appointments from, that had not yet been confirmed, it's those doses that we are withdrawing from Montreal temporarily, like we did for Montreal. We had added for a few weeks, and we're going to start by doing that week. Will it be 20,000, 30,000 doses? We're in about those numbers. And also, we haven't yet decided that all the regions that needed it, we are discussing with Daniel Paris' team and public health, but I would say that it would be between 15 and 20,000 doses that will be moved over the next few days. Mr. Legault, it had been a long time that you hadn't done that. You subdivided the regions in what you said, the Beauce, the Lac-Saint-Jean, rather than Saguenay-Lac-Saint-Jean. Would there be a possible tightening that would be done sub-regionally? Well, it can't be excluded because we can see in the past week that there is a stabilization, even a decrease in Montreal, but a strong increase for the 5 regions that I mentioned. So I don't know at what moment those regions are going to catch up to Montreal, but if those regions went above Montreal, there could be different measures, in fact, for certain regions. But sub-regions, like Beauce instead of Chaudière-Appalaches, Quebec rather than National Capital Area. Well, when we look at the increase in the number of cases, it is true that it's concentrated in sub-regions like the Beauce or Lac-Saint-Jean area. However, when we talk with public health, those responsible for public health in each region really like for us to look at the entire region because the crucial element is the capacity to welcome, to have people in hospitals. And the hospitals right now are for the entire region. Mr. Dubé, with the outbreak that we saw in a training room, are gyms becoming your new karaoke? I'm going to be very careful with how I answer that. I would say that actually we're going to be sending inspectors today, if it hasn't already been done, to see what took place, and we'll take the necessary measures. And if we have to close the gym, we'll close the gym.
Oui, bonjour à vous trois. On vous a beaucoup entendu dire.
We've heard you say a lot, Mr. Premier, since the beginning of the pandemic, that when you were in front of a choice, you would go towards the choice of prudency, that you go beyond the recommendations. But the last few days, we heard the Collège de Médecins, the INSPQ, and the Order of Nurses to emit doubts and reservations on the measures that are being set up right now. And at the same time, you're saying, well, we feel that perhaps people are not respecting the guidelines as much. Should we decode that from a strict point of view of public health, is you won't increase the measures because you think people won't respect them? Oh, well, that's special. You are saying the same thing as other people are saying. But yes, there is a question of following. Because right now what we are, seeing, and I'm going back to visits in people's homes, they are forbidden, but people visit one another. So they think that because we had made certain measures more lax, it opened up the door to measures that we have not removed, guidelines that are still there, things that are still forbidden. And what is important to remember, and it is surprising, is that there's been no increase in the number of cases in Montreal in the past 2 weeks. And that is pretty surprising because It is the epicenter with Laval and has been since the beginning of the pandemic. So we have to take all of these things into account. You talked a lot about hospitalizations as being the most important indicator in your decisions, and we also understand that the profile of people who are hospitalized is evolving. We could see in hospitals people who are younger, who have levels of care A or B, so they might stay hospitalized longer. In that context, to what extent is that still the indicator as we knew it, and that we had to base ourselves on that? If people remain longer than before because they need more acute care, they stay longer than before. I'm going to let Christian continue, but first we're giving you the data for intensive care and outside of intensive care. There's already a distinction made. And yes, we are following both of them quickly. We saw that there was a greater increase in intensive care, but that there was a lowering in non-intensive care. So yes, we're following that closely, and it's true that taking into account that people are younger, they remain longer, but it remains that in total, we're still below 500, which is good news. But we believe that it will increase over the next few weeks. We don't think that we'll stay at 500. We think that we'll increase to 600, and particularly in intensive care, to follow the increase that we've seen. We're now at 1,000, 1,200 cases around that right now per day. So it is inevitable that there will be an increase in the hospitalizations. But for the time being, it respects the capacity that we have in hospitals. But it could change in the next few days. And just a point to finish, what the Premier just said is, if I'm taking today's statistics, today we had an increase of 10 hospitalizations total, 6 of which are in intensive care. That is, that hospitals have increased by 4 in COVID hospitalization, like general, but intensive care has seen an increase of 6. But what is even more significant, and I'll bring the modifications as of tomorrow, is that right now we've seen 6 new hospitalizations in intensive care, but nobody left. And that is what we have to keep an eye out for and follow very closely. And I was talking about it with the Premier this morning and Horacio and Dr. Paterny. Right now, we're looking at it regionally to see what is happening in intensive care, because the issue is that we can see, and especially to whom we speak, what they say us is that the young people are not leaving the hospital as quickly. That's why we're giving you that information. I'm going to correct that tomorrow in the executive summary. We're going to show the people, the entries and exits for intensive care, and you'll be able to follow it. You know, the same way that we follow hospitalizations, it'll be easier to see. What I was told, Dr. O'Patterney was saying this morning, is that up until now, there were more people in intensive care that was available than outside of intensive care, whereas now it's pretty much equal in and out of, intensive care. So if the trend goes on, we're going to be tighter in intensive care units. And the message to give to younger people is that you're not vaccinated right now. And it doesn't mean that because you're young, it won't happen to you. There were younger cases, but it was mainly the elderly that we saw. So if you're young and you're not vaccinated, and even if you are, you still have to continue doing what you need to protect yourself. I'm insisting, but it's major. Physical distancing of 2 meters, washing your hands, and wearing the mask. Those things are very important, because it doesn't mean that because you're young, you want to end up in intensive care. And we know that this is what is going to happen, because we have protected the elderly thanks to the vaccine. And as long as the vaccine or the virus continues circulating, especially with the variants, there are more young people who are going to end up in intensive care. So it's serious when we say you have to respect the guidelines, because the more you respect them, the less you are exposed to a virus and fewer your chances of going intensive care and remaining intubated for weeks or months.
To
continue with the hospitalizations, first, Mr. Dubé, I'd like to know what the real actual capacity is for the following weeks and months. And Dr. Arruda, could you explain to us how we could have projections that are below the capacity if the variants are a lot more contagious, and that hospitalizations, as you just said, are, people are being hospitalized longer? Those are two questions. Well, very quickly, you can see it in the executive summary. The theoretical capacity for intensive care is 383. We are right now at 126. On hospitalizations, theoretical, we're at 487, whereas we're at over 1,000 in theoretical capacity. So you can see that we have lesser capacity in intensive care. The control of the variants is very strict right now. I don't know if you've noticed, but the contacts are isolated right now. We're increasing the capacity of testing in such a way that they are there, but we are trying to cut the transmission more intensively. And we're looking at everything, not just, yes, of course, we're looking at hospitalizations because that is how the impact will come. And yes, we're looking at people in intensive care. Yes, we're looking at age groups affected, but we also monitor how the variants are going. We are at the beginning of the third wave, but will this wave accelerate as quickly as elsewhere? All of that is the issue. That is what the race is.
Monsieur
Legault, you were talking about different scenarios for 5 specific regions. I was wondering, how much leeway do you have to be able to tighten the guidelines? Because the orange is almost the same as the red with the, change in guidelines announced in the red. So where could you tighten things up in the orange? Well, it could go further than the present red. We could go back to the red that we had before and a curfew at 8 p.m., for example. And in certain places in the world, the curfew is at 6 p.m., So there's all sorts of measures that exist beyond what we have right now in orange and red. There's all sorts of measures that exist, but once again, for the time being, our predictions show that we are within our capacity, but the trend is bad, so it has to stop increasing in those 5 regions. It's not increasing in Montreal, but it's increasing in those 5 regions. How much time do you give those people in those regions? Is going to be updated before Easter? It's not impossible that there be one tomorrow or Thursday. We really are following it closely from 1 hour to the next, 1 day to the next.
Okay.
English?
British Columbia is adding measures. Ontario is saying their situation is out of control. And in the USA, where they're further in the vaccination process, the head of the CDC just warned that there is an impending doom, un effondrement imminent. So why are we different in Quebec? Why we would be different? To not be hit as hard as everybody else?
First, our situation is different. When you look at the number of cases and the number of hospitalization, our situation is now better. Our measures are tougher, including the curfew at 9:30. All the restaurants for 60% of Quebec in red zones are closed. So we have to take all that into consideration when we compare with other provinces or states in the United States.
And when you have the College of Physicians telling you, well, how come you're going in that direction with high school students, for example, and why are you're not making sure that restrictions are more severe? What are you telling them? Are you telling them, well, it's not the target. The target, it's young adults in orange zones not respecting that indoor gatherings are not allowed. What do you tell to the College of Physicians asking you to put more restrictions right now?
I think it's a risk management because there is not only infectious disease, there are kids that are going to fail their year. There are kids with mental health issues, actually. And, public health is not only infectious disease. That's also those impacts, violence to women and everything. So we must take that into account. And as it is our priority, I would say education for kids, we accept a certain level of risk, but we always told that even if we want people to go to school, that it would be easy to go back and stop the presence in school with new technologies and things like that. But actually, we do respect their opinion. But we have to take into account other factors that they are not taking into account right now. And Quebec, even the orange, I would say, level in Outaouais is stronger than the red in Ontario. So it's not true that we are so open like this. That's a perception because we change some things. But at the same time, we are a tough, I would say, approach in Quebec in relation to other levels in other provinces.
Michael Fletcher, Global.
Good afternoon. I'm having trouble deciphering what your tone is this afternoon. One of my colleagues in French asked you, Mr. Legault, if last week you were too jovial when you were talking about maybe being able to head off a third wave, and then a couple days later, Mr. Dubé announced that we are in the third wave. Today, you've said a couple things. For instance, you know, the vaccine objective that you set for 1.3 million, you've achieved that. We're still in line to vaccinate everyone who wants it by June 24th. However, you've sort of given this warning as well that, you know, cases are going up. We haven't received, or we haven't hit the capacity for hospitals, but we could. So what is the message today? Should we be worried, or should we be happy, or should we be?
Okay.
What takeaway should we have from this?
Okay, so last Tuesday what I said is that we weren't in a third wave at the time, but I said also that we expect that the majority of our cases will become variants, and then it will increase the number of cases. We also need to take into consideration the hospitalizations. And last week at the same time, we were at about 500 hospitalizations. We're still at 500 hospitalizations. There was no increase in the number of cases in Montreal since last week. So we need to know that, yes, the variants will increase the number of cases and eventually the number of hospitalizations, but it's still within our capacity. The problem we see is that people in 5 regions right now don't follow the rules that are in place, especially for visits in homes. And that's where we have a problem. And if need is, we'll put additional measures. Because right now, we see a very fast increase in those 5 regions.
Dernière question, Philippe Autier de Gazette. There are a lot of people that find this development in the third wave of all these young people getting the COVID, ending up in hospital, ending up in the ICUs. It's a very disturbing image for a lot of people. Is this somehow going to create, if this is let go, if this is allowed to continue, is this going to somehow create a herd immunity in Quebec? Is it, if it's let go like this, can you really get it under control?
In fact, we are not letting things go to get herd immunity, because I think really that the vaccination was going to give us some protection. But I think that people must understand that there were those kind of cases before, but they were masked by the other ones. Now that we did protect elderly people, those virus is attacking the ones who are not immune. And as there is more and more cases in youth, there is going to be more probability, which will not be so high as the elderly, but there's going to be young people getting to hospital and getting to intensive care. And as when you're young, you need to be treated. It's different from somebody who is very old, who asks for not going to the hospital and everything. It's clear, that's it, and it's why I was telling that to youth people, don't take COVID-19 is not serious. Please respect the things, have a 2 meters distance, wash your hands, and have a mask.
Merci à tous. Bonne fin de journée.
Thank you, everyone, and have a great day.